There are some questions that have been coming up regarding coronavirus and how it affects the eyes. So we are joined by Dr. Alan Solinsky now. He's an ophthalmologist, at the Hartford Hospital Eye Surgery Center. So Dr. Solinsky, thank you for joining us.
Thanks for having me.
Now, our first question for you, how does COVID-19 affect the eyes?
COVID-19 can affect the eye much like viral conjunctivitis could affect the eye. It hasn't really penetrated very much at all. It's still a very rare finding, and in our busy practice, we have not seen any patients with COVID-19 viral conjunctivitis.
How does COVID-19 pass through the eyes? Is it, we know that the virus particles can sometimes be found in tears, right?
Yes, same way any virus could get into the eye. Usually it's hand-to-eye contact, or a sneeze might get there, or you might be sharing the washcloth or the pillow of a loved one. So again, all common sense things that you do for a regular viral conjunctivitis to prevent its spread, you would do for the COVID-19 virus as well.
So even though COVID is not commonly causing eye infections, it can still be transmitted through certain ways, including touching your face?
Yes, it could. It could be transmitted to your tongue, to your saliva, to your eye, and if it does get the eye, it could stay in the tear film for several weeks, even several months.
Oh, wow. And are you seeing patients now? I know things are slowly starting to reopen.
Yes, the American Academy of Ophthalmology told ophthalmologists to stop seeing routine patients back on March 18th, which all of us did in the greater Hartford area and all of Connecticut. We were seeing patients that needed retinal injections to keep them from going blind from macular degeneration. We were seeing patients with really bad glaucoma or lid cancer, so anything that couldn't wait. So our volume went down to about 20% of what it usually was due to that. We continue to see emergency patients, emergency eye patients that had flashes and floaters or pain in the eye or any decreased vision. So that was done, and ophthalmology was decreased by about 80%, which is the most of all specialties because most of our patients are older, and our surgery, which is mostly cataract surgery, is elective.
Right. So certainly any of your patients, if they're curious about, whether they should come in for surgery, if they have any questions about their comfortability, they should give you a call, right?
Yes. Now we've been seeing routine patients for the past week, and our offices are very, very safe, and the surgery centers are very, very safe. Across America, there's about 2 to 3 million cataracts that are performed every single year. So in this 2 to 3 month period, there's about 500,000 people on the sidelines who made decisions to have cataract surgery back in February, March, and April. And they did that for very good reasons, such as decreased vision. They couldn't see at night, they couldn't do their daily tasks, they couldn't read, maybe they couldn't see the golf ball far enough. So those things are still present, and in fact some of the patients that have been seen this week that I haven't seen for a few months, their vision's much worse. So it's very, very important, even though it's an elective surgery, it's not life-threatening, very important to have the surgery done at this point in time, that it's very safe to do it.
All right, thank you very much, Dr. Alan Solinsky from the Hartford Hospital Eye Surgery Center.
Okay, thank you.